Reddy, who will be talking about how he practices sustainability.
Thank you, Dr. Venkatesh. And I think this is a mindset. The practice of sustainability is a mindset. And if we go one generation back to our parents or grandparents, everything was sustainable. Now, over a period of time, we have changed to a Western model, which again, we are going back. The West is also going back with us to make sure our lifestyles are sustainable. We know this, that gases released into the atmosphere due to various human activities is trapping heat and making Earth warmer, and our lives are threatened. Carbon dioxide, nitrous oxide, methane, and chlorofluorocarbons are the main sources of this warming climate. And then 5% of emissions are due to healthcare worldwide, and as David Chang was saying, that 10% in the US are due to healthcare emissions. Our Hippocratic oath is to do no harm, both for the patient and the planet, and we should remind ourselves of that. We have to decrease environmental footprint personally and professionally. Profession comes later. Personally, we need to do it in our lifestyles. We should be convinced that this is the way to go for our children, grandchildren. And besides global warming, it's also the plastic, pesticides, which we are contaminating the earth should also be part of that crusade. So the basic principles in our lives and in our professional as well as personal lives should be to reduce, reuse, and recycle. So in the outpatient service, as was discussed earlier, but I'd like to emphasize, avoid or decrease patient visits. Sometimes, majority of the times, our economic reasons come into the picture when we are doing our practices, but I think that's not the issue. We have to follow our Hippocratic oath and make sure that we do help the patients rather than harm them. And then I've seen some of our colleagues calling patients 6 monthly, but I think it doesn't make sense. Yearly or 2 yearly follow-up visits are enough. We have to revisit this and see really how many visits we really need to provide of appropriate health care and teleconsultation if appropriate. During COVID times, because normally I used to call my patients 1 day, 1 week, and 1 month later for cataract surgery. But during COVID, because it was difficult to call them, we used to call them a month later. And I found that in the last 3-4 years, it didn't make a difference. You can call them on the first day, and then if they have a problem, we can tell them that these are the signs which you need to be aware of, and then come when needed. So that way, each patient had one visit less, and it's appropriate environmental and personal advantage. And then electronic medical records have already been shown. All of us can go even in our clinics. It's easier, it's less expensive. Fortunately, all environmental practices are also cost us less, both for the patient and for us. And if you're giving a plastic file, you can charge for that, because every visit a patient wants a plastic file. You can avoid that. And the patients can have, nowadays, most of them don't keep a copy. You can have them in their mobiles by giving them a soft copy of the report at the end of the visit. Decreasing prescription of glasses, because there's a self-interest involved both for the doctor, for the optician, and then they tend to, even for the 0.25 change, 0.5 change, when most of the time it's not necessary, we prescribe glasses, which are encouraging use, of the new materials. So for that, we can advise, because most of the times the patient says, doctor, is it really necessary? Our economic considerations do not step in, only change if needed. And medications and eye drops also similarly, and now we've discussed about that we can use till the end of their life. And otherwise, we have already drilled for so many years into the patients that they can use only for a month. Even costly drugs, they just keep throwing away. So that we need to stop. And to encourage sustainability and to create a mindset amongst patients, we can have a container in our hospitals regarding used spectacles, drops, bottles for recycling, and probably give them a small 10 rupee, 20 rupee incentive for them to return them back, not basically for the cost, but for the environmental protection. Reusable theater linen. I've been trained in Aravind earlier. So eye towels, caps, gowns, so many of them we tend to reuse and create a huge amount of waste, which we can safely reuse them. Minimal use of betadine and chemicals. Iodine is one of the deadly chemicals which will contaminate the environment. We have to sensitize our staff to use a minimum use. And then glass syringes, unfortunately, I've been using for so many years, but now they've stopped making glass syringes. You can stop so many hundreds of plastic syringes by just autoclaving them along with the instruments. But when I inquired, they said that glass syringes are not being made now. So I think we can try to advocate for that causes. And then many things, cannulas, iris hooks, many of them can be autoclaved and reused. Asked the industry to recycle phaco tubings, and one of the major industries, when I asked, they said that the country had said it's a municipality's problem. I mean, that was the answer I got. So that's ridiculous. And then we have to make sure that these people take back their plastic and then reuse it. And then, and as David Chang was saying, we can use reusable tubings in certain machines. And then industry has a reason there, and we need to make sure that they don't utilize it appropriately. And then every technology should have a green audit also. Like if we are thinking of, say, femtocataract, how much more, especially in India and developing countries, if you are trying to encourage femtocataracts or whatever, the consequences, both in terms of cost and waste which is generated, it's appropriate in certain conditions. I think we should not use it appropriately rather than say that it is good for everybody. Staff motivation, discourage single-use plastics. And last time during our Diwali thing, we distributed steel water bottles for all the staff so that they can reuse it rather than use more of plastic glasses. And then decrease use of water, electricity, AC temperature settings. So majority of the times they have set to 18 degrees or something, but appropriately 22, 23, 24 are the ones. All of us, just to make a point, all of us use layered clothes and then keep the temperature at 20 or 18. And for tropical climates, we don't need 3-piece suits, 4-piece suits. So we need to sort of have appropriate clothing. Paper usage can be decreased or double-sided can be used. Segregation and appropriate disposal of all waste, including e-waste. Equipment can be repaired in most cases. Nowadays, the trend is to use newer equipment rather than repair them, and avoid harmful chemicals in your pest control and cleaning procedures. Building designs have been already emphasized on, which is really nice, but you don't need extensive spaces for clinics. Appropriate amount of space is enough because it increases the cost of everything, including maintenance, planting trees, solar panels. I've been trying to source for ethanol generators, but they're not available. I think we can ask the industry where ethanol can be used for generators for our energy backup. And then use of electrical vehicles, all of us know. And then eco-friendly designs has been discussed. Water recharging has been discussed. Sharing equipment. We have a group practice wherein for the last 25 years, a lot of private practitioners come together. We have 20 or 25 people who use femtocataract, which goes to each clinic. We use refractive surgery, which we have a common facility, and all of us get our patients and pool them and use it. So all this helps in decreasing the environmental impact of technology. Lifestyles, of course, plant-based foods, online meetings, and climate-friendly clothing, as I was suggesting, would be of real help. But it's a mindset. All of us should think of that. Thank you very much for this opportunity, Dr. Venkatesh and AIOS.